Welcome back to Tech Pulse, the show where we cut through the hype in science and tech to bring you what actually matters. I'm Zaper, steering today's conversation with a mix of curiosity and hard truths.
And I'm Puck, the guy who's going to poke holes in whatever Zaper thinks is a hard truth. Chuckles. Hey, before we dive in, don't forget to hit subscribe, drop a like, and share this with a friend who loves debating tech over coffee.
Today's headline: Studies find AI healthcare tools show bias against women and minorities. Yep, you heard that right. The very systems designed to help doctors are sometimes hurting the very people they're supposed to serve.
Okay, hold on. Let's slow down. Bias in AI healthcare, that sounds huge, but what does that actually mean? Like, how's a piece of code biased?
Great question. So, AI tools in healthcare, like chatbots that suggest treatments or diagnostic models that scan x rays, learned from historical medical data. And here's the kicker: that data already has gaps and prejudices baked in. So, when AI learns, it's picking up those same flaws.
So basically, garbage in, garbage out, but now the garbage is wearing a doctor's coat.
Exactly. Let's get into the numbers. MIT, the London School of Economics, and Emory University all ran studies. They found AI systems like GPT-4, Meta's Llama 3, and even healthcare-specific tools consistently recommended lower levels of care for women and showed less empathy toward Black and Asian patients.
Wait, less empathy from a machine? That's wild. I mean, empathy's already in short supply in healthcare. If AI is worse, that's a problem.
One example: for an 84-year-old man, an AI described him as having a complex medical history. Same notes for a woman, the AI said she was independent and able to maintain personal care. Same condition, different spin.
Wow, so men get complex cases, women get, oh, she's fine. That's not just bias, that's malpractice with extra steps.
And it gets worse. In psychiatric care, one model, NewMes 15, was more likely to recommend guardianship for Black patients with depression or tell African American patients with anxiety to cut down on alcohol while giving white patients totally different advice.
That's straight up stereotyping. The AI isn't diagnosing, it's profiling.
Now, Puck, here's where it gets messy. Microsoft just claimed its AI diagnostic tool is 4 times more accurate than human doctors, 85% accuracy on real-world cases.
Oh, come on, 4 times more accurate? That's like me saying I play basketball 4 times better than LeBron. I just can't throw out a number like that without asking, accurate for who?
Exactly. These tools may perform great in lab tests, but crash when faced with diverse real-world patients.
And meanwhile, regulators are scrambling. 6 U.S. states already mandate a human doctor must review AI-based insurance denials, which says a lot. Lawmakers don't trust AI to play gatekeeper on healthcare dollars.
And the Department of Health and Human Services dropped a final rule making hospitals legally responsible for AI bias. They now have to prove they're not discriminating when using these tools.
Whistle, that's heavy, but you know what? Part of me thinks, good. If tech companies want to play doctor, they should face the same malpractice risks.
Careful, you're starting to sound like you're siding with me.
Don't get used to it.
The irony is, companies like Google and OpenAI keep saying, "Don't worry, those were older versions of our models." It's the same excuse every time.
Yeah, that's like me failing a test and saying, oh, you graded my older version. It doesn't work that way.
And MIT warns this is only the beginning. Since AI can actually predict patient race from medical images without ever being told race, it risks amplifying those same disparities unless we fix training practices.
So the AI is basically saying, I see patterns in your x-ray and I know your race. That's creepy, not helpful.
Bottom line, AI in healthcare is powerful, but these studies prove it's not neutral. It mirrors society's inequities, and that can cost lives.
And the takeaway for listeners, don't just trust the 85% accuracy headlines. Ask who's being measured, who's left out, and whether there's a doctor double-checking the bot's homework.
Perfectly said. That's all for this episode of Tech Pulse. Don't forget to like, comment, and subscribe. And tell us, would you trust an AI to diagnose you, or do you want a human doctor with all their flaws?
I'm Puck.
And I'm Zaper. Thanks for tuning in to Tech Pulse, where the debate never flatlines.